The final sequence in the lower extremity malalignment exam is the leg length inequality or pelvic symmetry assessment. We do this in frontal plane and observe landmarks. So we're looking at the medial malleoli, the tibial tubercles, the patellar poles, the popliteal creases, the ASIS, the PSIS, and the iliac crest. So manually we like to come in here, just a quick review. We can palpate the ASIS here, both thumbs on there, visualize the level here. Normally I'd want a frontal view, but for the purpose of visualization of the camera, I'm just standing off to the side slightly. So we want to palpate the ASIS, the top of the iliac crest. We want to look at the full alignment, the patella, the ankles, the feet orientation, and again follow some of the other frontal plane examination techniques as well to see if there's anything that may want you to visualize and inquire a little bit more into a leg length issue. Again, Alana, you can turn around for me. All the way around, please. Okay, we can just have her relax. We can see the level of the PSIS. Again, look at the iliac crest again from the back, and turn around one more time. Good. So, if we do notice that there's a slight pelvic obliquity or an elevation or a drop of one of the iliac crests, we actually can stick small 1/8 inch boards or magazines at a time to actually have her step on to see if she feels more level and if we as a clinician see a leveling out of the pelvis. So I can just grab my magazine here. Let's pretend that we see that the right hip was slightly elevated. What I would do is actually take this magazine and just have her step right on it, okay? And I would say, Alana, how do you feel? Do you feel like you're uneven? Do you feel like you're too high on the left now?
Too high on the left.
Okay. So Alana actually doesn't have a leg length issue, but if she did, she may report, wow, that maybe doesn't feel good, or wow, this feels good. I feel a lot more level. Okay, so you can actually do this a little bit at a time, adding more and more 1/8 inch magazines or 1/8 inch blocks to the limb to see if that makes her feel better, and that could be a potential adjustment or post on an orthotic that we may fabricate.